All right, so hi everyone. Look what I have. So this is a certificate of completion by the ADC. This is how it looks like, by the way. I don't know if you can see it. And I have the absolute lovely Liliya Silva, Dr. Liliya Silva. I mean, we're all doctors here, but now she's registered in Australia. So congratulations, Lily. And today Dr. Lily has kindly agreed to have this little success interview because she just received her results yesterday and she has finally cleared her ADC Part 2, the practical exam, and she's officially a dentist that she's going to be starting very soon. Now, the other beautiful thing is actually Dr. Lily has been part of our prep doctors team. She was part of the Edenta team before we became prep doctors. So she has an amazing story to tell. And what is even more amazing about her is, as you can see here, Dr. Raj is sitting next to me. Many of you know Dr. Raj. She is the director of Part 1 course. Many of you already know her or have been through the Part 1 course. And Dr. Lily was also part of the Part 1 course. So she was mentored by Dr. Raj in Part 1, and then she was mentored by us in her Part 2. She is a dedicated, hardworking person. She deserves nothing but success. She really does deserve to clear her exam. And today she'll be sharing her strategy with you on how she prepared, what she faced in the exam, and sharing the story to inspire you to know that it is actually quite possible for you to clear this exam. I know many of you go through it. You either lose hope or you think it's a matter of luck. We will be talking about the luck component of it, but also she'll be sharing with you practical strategies on how to actually prepare for the exam. She'll start her journey from the Part 1, but mainly obviously we're going to be focusing on the Part 2 because that's the heavy, where the heavy lifting happens. So, hello, Dr. Lily.
Thank you very much for having me. And thank you for helping me to go through all of this. Without you, it would not be possible. And yeah, here we are.
Here we are. Here we are indeed. So, Lily, I want you to tell me in your own words when you decided that you wanted to do the ADC, before you joined us, before you even knew about us, what was going in your mind? When you knew like you have to do the ADC process, you decided to migrate to Australia. I know that you actually came from America.
Yes.
So you already went through a process of like accreditation to some extent.
Yes.
I mean, I know you didn't complete it because you decided to come here. But share with me the mindset of someone who's coming here and then they realize they have to do something called ADC. What was going in your mind?
It was just another exam because I have completed the NBD exams in America, which was a theoretical exam. So I was thinking how close they are, and they're very, very different. So it took some time to lodge and do my initial assessments with the documents getting from different country. But then I was just thinking that I'm just going to go and see how the exam is done. So I went completely without the preparation just to see how exam is done. Of course, I failed it the first time. And then I decided to seek some guidance.
Yeah. So what made you the first time decide that, oh, I'm just going to do it myself? Was it overconfidence, or was it like, oh, how difficult it can be? I've already done a more difficult exam than this.
I have completely prepared by myself for American exam. I didn't take any courses. So I was thinking that I have enough of knowledge and enough of pool of knowledge for ADC exam. But when I went for the exam itself, I've seen that it's very, very differently conducted. Yeah. That definitely it is possible to do by yourself, but you never really do it by yourself because you rely on groups, and this said this and somebody told that, and it's like a broken phone. You never get it from the source. So I didn't want to do that.
Yeah.
I wanted to go to the people who have a lot of success, and I searched for it and I found you.
Beautiful. Well, I'm going to get to that for in a minute. But actually, what Dr. Lily has shared is something quite important. I'm going to let you add to this as well because I know you have a very strong opinion about it, which is very, very important. Is many people think that, in particular with the ADC, because ADC is just two exams, right? It's the written exam and then it's the practical exam. And you fall into the trap, which, by the way, I was literally in your boat. I didn't do it surprisingly in part one. Part one, I decided to get help from the beginning, but I did it in part two. I don't know why, even though part two is you need help more, is that you look at the handbook, you look at the resources, and you think how difficult it can be. And don't get tricked with the example that they put in the handbook. It looks very easy, it looks very straightforward, but even in your time it was still somewhat you are able to like maybe do it without preparation, but especially with the new clustered way of doing the part one, very clinically oriented. Honestly, I have barely heard anyone passing their part one without some sort of guidance and preparation, because it's very clinically oriented, and not just clinically oriented, because I know for those who are experienced and practice as clinicians who say, oh, it's easy for me. It's actually clinically oriented based on Australian guidelines. And it can be really tricky, and it really does require that explanation and discussion and the thinking part of it. So I really appreciate that you shared that, because many people in right now they're in your shoes back then, and they think that I can do it by myself. Now I have to like disclaimer here, absolutely you can do it by yourself. There are many people who actually try to do it, but statistically, and we've been this in the process and teaching for years, statistically it's less than 5%. And why would you want to reinvent the wheel? And success leaves clues. So if somebody has already done it and they have the proven formula, why not just go and be part of that and accelerate your success? Now, Dr. Raj, what would you like to add into it, especially about part one?
Definitely, when you are preparing for part one as well, you need to have a good idea of the question format which comes in the exam. So basically, when ADC started shifting from one pattern to other, the cluster pattern came into effect, and then, as Dr. Lina mentioned, it's more of a clinical based exam. Now, when I say clinical based, that means not asking you the values, not asking you the numbers, or what is the temperature and all those things, but how you actually practice in a clinic. So, what is the approach? Basically, focusing more on the approach, more on your planning, managing your patients. When this all things come into effect, it's more important that you understand how it works in Australia. Like, we all are overseas dentists, we have to give this exam. But if you give it in a proper way, if you prepare it in a proper way right from the start, then you have the proper guidance to go, okay, I have to go through this, I have to go through this, I have to go through that. And then you have to remember there are certain things that you will have to unlearn, which is the most difficult part, because this is the first aspect which you encounter, that is your written exam, where you have to unlearn things and you have to learn it in a way according to your Australian guidelines. So the approach that we follow here, how it has to be, how you gather the information, not just asking 100 questions to a patient, but specifically listening to the patient and then finding out, okay, what exactly you have to focus on, and then amalgamating it with the guidelines and the protocols that are followed here. And again, when I talk Australia as well, you have different states, so different policies, so a lot of things. But yes, guidance is required so that you can trim your time, rather than we diverting and going through so many books and so many policies and going through so much of material and finding out what to study. If you get all that in one place, you actually shorten your preparation time. So you can focus more on what is needed rather than skimming things and finding out what is needed. So that was provided, like, okay, what is needed is provided here. You just have to keep revising, and the consistency of the preparation, I would say.
Very well said.
Very well said. And I always use this quote. I forgot the author's name, but you can go and Google it. But he says, a very famous philosopher. He says the illiterate of the 21st century is not those who can't write or read, but it's those who are unable to unlearn, relearn, and learn again. So have that in mind. The relearning and unlearning of many things. Now, Lily, you decided. And this is where I'm so happy because we get to the point where you decided, okay, I need the guidance, and you chose us. Can you tell me why you decided that you wanted us to be part of your guidance?
So I have been working as a dental assistant in a clinic with one of the dentists. He is an Australian-born and Australian-trained dentist, but he had a friend who was South American orthodontist, and he was telling him that he was going through the process and it took him a while, but now he finally passed. So I asked him, did he use anybody? Who did he pass with? So he texted the friend, and the Lina's name came up. So I went and signed up.
I so appreciate you deciding to sign up. And then you did mention that when you cleared your part one, you had a friend who asked you how.
Asked me, how did you clear the part one? And then she goes, okay, I'm going to sign up as well. And she cleared her part one in the first attempt, and then part two in the first attempt. So.
And we were talking earlier, and I completely I mean, I didn't forget you, Beatrice, but I just forgot the story about her friend who she was also in the part one, in the part two, and cleared all the exam, because we were talking about how that when you were preparing your exam, literally, Dr. Lily was like, I can confidently say that Dr. Lily chose her ADC preparation start to finish. No one else. She didn't go anywhere else. I even used to ask her, like, did you hear anything, or in the group? She said, I'm with no one. I'm in no group. I don't want to, I just trust you guys. I know what you guys are delivering, and I'm just with you, and I'm not going to give up, and I'm just going to prepare. So she did her part one with us. She did her part two, the whole thing, the skilled OSCE, the technicals, the OSCE communication, the online, the on-site, everything. She didn't go anywhere else, and she put the hard work and the perseverance, because it's not, nobody can make you pass, they just guide you. It's what you are doing with the guidance and what you are doing with the teaching, and you're putting the hard work and putting the hard effort.
Unfortunately, there is no magical pill.
There is absolutely no magical pill. So I appreciate you trusting us in the process. And Beatrice, hello, if you're watching the video. So Lily, looking back now, and I'm sure that you're still fresh in terms of like remembering how it was as a candidate, what kind of advice you would give someone who is in the process? What kind of advice would you give someone for the part one? What kind of advice would you give for the part two? Let's start with the part one.
Part one is heavy on the knowledge, and condensing that knowledge and delivering out of the whole pile of the knowledge, you just deliver a little bit. So repetition and being familiar with the concept, with the clusters, and just learn from appropriate sources, articles, books, not she said, he said, not this possibility, or maybe somebody did something else in the exam and it was okay. Learn from the proper sources and just revise.
Absolutely.
There's no
And you were regular. You were regular in attending the lecture. I remember.
Beatrice, Lily, there were so many of
Because I know she was very regular in the OSCEs, but obviously part one I can't comment, so I just went Radha. She was, and the reason why I'm saying this, by the way, because again, success leaves clues. Success has habits, and it has a pattern of thinking, and it has a certain pattern of behaving. You will see this. I mean, you are officially the first success story as the rebranding of prep doctors, and now merging with prep doctors. We have had many success stories back with eDenta, and once we, you're gonna. I know this is a matter of time. It's just going to be happening. We're still waiting on candidates with their results. The more we're going to do these success interviews, I want you to continue seeing you're going to see a pattern. Every person who has managed to succeed in their exam has had the same pattern, which is putting in the hours and focusing and trusting the guidance.
Yes.
Because this is what I see, this is what we were talking about. I know that outside there are some people are giving only the skilled OSCE, some people are just giving OSCE, some people are just giving part one. We are one of the very few institutes that are genuinely comprehensive from the A to Z. And we're also one of the few institutes as well that we take it in a holistic approach. And you always used to say, Lina, come and do your little motivational talk, because it's a holistic approach. There's a knowledge component. And then there's the soft skills component of how you implement your critical thinking, and how you are implementing the decision making, and how you're dealing with difficult situations. Then there's the stress management and the time management and the pressure, and you being a mom, being a dad, being someone working full time. Like, there's so much that goes into it. And genuinely, this institute is being built on from candidates to candidates. Like, we've all been there. We've all went through the exact same process. Everybody of us have their own story. But you Lily, genuinely showed the habits of a successful person. That's why it was a matter of time, which luckily you still managed to get it done in a reasonable amount of time. You're attending the lectures. You never argued. But you were asking questions. I've never seen you argue. You ask questions.
I don't argue.
Yeah. Oh yeah. You're the type of person who don't argue. But you didn't question. But you were asking your questions. You were.
There's no such thing as a stupid question. The only stupid question is the one that you don't ask.
Absolutely.
If you have a doubt, you're better off ask. As I say, if you have a doubt, ask about.
Absolutely. Cracking the exam now. Is the exam there to get you and designed to never make you pass, or is it just a very competitive exam?
It is a very competitive exam. The problem is with us as a candidates is ourselves, is our own mind, is our own head. You go in, it's a very stressful environment, but I found ADC examiners are very nice. I mean, they all doctors, they specialists, they're not there to fail you. They're there to actually see the skill, what you have to show, and to make sure that you can practice safely in Australia. So I found them very, very helpful in every station, and pretty nice in the communication as well. So it's those scary stories. It's easier to put your failure on, the examiner was mean,
Yeah.
the center was too hot, or it was too cold, or the amalgam was not well. No, everybody deals with the same amalgam, everybody deals with the same examiners. Examiners are there to make sure that you are able to practice in Australia safely.
Absolutely. And to comment on that, and this is specifically for part two. The reason why we put so much emphasis on the consistency, right? Putting in the hours. For those who have taken our courses, again, that's another book that I quote a lot, which is a book called Outliers. And Outliers, the author of this book is somebody who went and studied the most successful people on the planet. We're talking about the Bill Gates and the Michael Jordans and the Steve Jobs and all these highly successful and athletes. And what he has found as, again, the pattern of success is that they have put in, metaphorically, almost more than 10,000 hours into something for you to reach mastery. And this is such the perfect analogy and metaphor when it comes to the ADC, because again, we were just talking about it earlier. I said ADC is almost like the gold medal. It's only one person that will get the gold medal, right? So in each batch, it's usually one, maybe if the batch was so strong that they couldn't fail, maybe 3 people out of the whole batch. So when we know the success rate is around 14 to 15%, you have one of two ways of thinking. Again, when you said the way that we think about it in our mindset, there's the positive thinking where I can be one of those 15%. Success leaves clues. What do I need to do? And because if you think about it almost like the gold medal, you think about it, these world athletes, how many hours do they practice? Michael Jordan used to say that he used to practice 3 times more than what his team was doing. And that's why he was the Michael Jordan. And many, many stories like that. So you need to put in the hours. to tie it to what you were saying, there's the internal environment, which is you, the amount of work that you're putting, the consistency that you're having. And then there's the external environment. You can never control the external environment. You might be right. That examiner was very difficult. The materials wasn't in that day good. Your amalgam set or broke. You were sick and had a stomach ache. Look, whatever excuse you had, again, I call it very valid excuses, but it's still excuses. Because if you work on your internal environment and yourself, and you practice so consistently and so well that it becomes the second nature, no matter what environment you're at, you are going to produce the same thing. Even if the quality drops a little bit, you're still overall going to be managed to pass, because you are not relying on the what's out there that is completely outside of your control. You're relying on yourself. That's why an experienced, competent dentist, and that's literally what they assess you for, is no matter what clinic they go, no matter what day there is, even if the dental assistant change and they put them with an inexperienced dentist, or your favorite instrument or the one that you use all the time not there, you're going to tell the patient, oh, I'm sorry, I'm not going to be working on you today, or I'm going to give you a very bad amalgam today
because I haven't practiced 2-6.
Exactly.
I only
No.
like 4-6.
Exactly. No, a competent dentist will still produce the job no matter what environment they're in. And that's what they want to see.
And in communication, OSCEs as well, they are not there. Oh, the examiner was asking me so and such a difficult questions. No, they're not difficult questions. They are valid questions of the patient. You see these patients in the clinic day in, day out. When people come with pain, they want you to solve the issue. When people come with their children, they want to look after. They want you to look after the child. So it's not that they're there to ask you these tricky questions. There's no tricky questions. Those are real questions of the real people, and it's up to you as a dentist.
I'm so
to
happy
address
that
it.
you're mentioning this. I'm so happy because, again, it's like, what are the examiner's questions? But and this is, by the way, this is the reason why it's called a success interview. This is not an exam experience. We're not going to be doing any exam experiences. We collect information, by the way, and we go and we share like what new information, what new examiner questions. You haven't had anything outside the norm. Like everything was pretty much.
There's no such thing for me as outside of the norm, because I've seen in the clinics, you see all sorts of people. And there are easy people, easygoing people, and there's not as easygoing. There's more worried people, there's less worried people, there's introverts, there's extroverts, there's people with all sorts of issues, anxiety, disabilities. So there's no such thing as out of ordinary question. Every question actually valid, and it's up to you to turn your critical thinking cap on and actually address the patient and look after him.
Yep.
What is the
Yep.
best for him?
That's the thing. Critical thinking and problem solving skills, and being patient centered. Never
You have to be
ever
patient.
forget.
You have to be patient with them. You can't tell them something if you haven't listened.
Yeah. What would you like to?
A good listener. A good listener is very important, because what I have seen, as Dr. Lily is mentioning, yes, like since my days as well, when I used to hear, okay, examiner asked me this, examiner asked me that, and I was like, seriously? Because like on my exam day, I think the most happiest moment was talking to the examiner, literally talking to the examiner, and because it was a person with whom you're conversing, like you're just having a conversation. So it's a very calm moment actually. You are just having a conversation, you're trying to listen to the patient, you're trying to understand what is the actual issue, to what extent you can help ethically and professionally, and what in that 10 minutes you can beautifully give it to a conclusion and just summarize it at the end, rather than giving a non-stop speech or elocution, which many people do. So they need to understand that it's not an area where you're standing and just giving a speech or an elocution. It's actually a conversation, a two-way person. So two-way conversation is happening. So both parties should be engaged to that extent, and both parties should be respected. So you have to listen. You have to listen to your patient. If you don't listen to your patient, then definitely you can't help the patient.
Absolutely.
Yeah.
And that's actually like in communication one on one. It's not speaking. Communication is actually listening. It's active listening. Exactly, because it's not about it does not matter what you say. It really does not matter. If the person in front of you did not get what you were saying, or you made so many assumptions, you took the case, you read it, and you start talking and talking and talking and talking, and the patient just saying, but I wasn't even complaining about that. Like that wasn't even the reason why I'm here today, but because you memorized this case. No, we discussed it. It come like this, and you lose the case on silly things. Now, I do want to say, because again, we know Dr. Lily really well. She has taken the part 1 and the part 2 with us, and I'm proud to say that she has gone absolutely nowhere, and she put her complete trust in us, and I'm so grateful that that the trust was in the right place and that you managed to achieve your dream. Dr. Lily is not only focusing on the soft skills, which we teach a lot about it, the soft skills such as the communication, the critical thinking, the problem solving, and the ethics, and the compassion and the empathy. Dr. Lily studies very well. She reads, she educates herself. So she manages to combine, okay, I need to have very solid knowledge while knowing what how much information do I give my patient and how much information should I withdraw? Because exactly what you said, right? You said you're dealing with anxious patients, then you're dealing with very highly educated a patient with a very high IQ, that they require more explanation than someone who barely understands what a root canal is. So you don't go and overwhelm them with that type of information. So that's where emotional intelligence comes. Like if I give you any advice, go and read about emotional intelligence, go and listen, watch videos. I hope that if you're not part of our courses, that you end up coming, because we really do put that emphasis on that. But I want to make it really clear. You have to combine the hard skills, which is the knowledge, and the technical skills, and your clinical treatment all together, plus the soft skills, which is your communication and your empathy and the ethics. They all need to be combined. Some people sadly go either too extreme to the hard skills, so it's all about the books and the knowledge and what I need to say or what I need to study, or they go too much into the soft skills. But I was kind, I was nice, I was slow, I explained anything. Yeah, but you still gave the wrong treatment plan. It doesn't work that way. One last thing is your how did you manage your stress, if there was any? And 99.99% everybody goes through the stress, like no matter how tough you are, it's quite a heavy exam. And how did you manage your time? Because this is one of the biggest issues: time management and stress management.
Time management was not a problem for me because I practiced a lot. So I knew how much it takes for me to produce a single task. And I also practice, let's say when I started, I did the crown prep from, on all 32 teeth, and then I unscrewed them and put them in the bin, and then I repeated.
Wow.
Because when your patient comes, you say, I'm so sorry, I cannot produce the crown of your, 4-5 or 3-2.
It didn't come in the exam, so I'm not going to practice
come in the
it.
exam. You can't do this. You have to know everything, and you have to learn everything. Your hand have to be good. So you practice, and that's how you should go in the exam, knowing that you actually can produce predictable work with those instruments and with the material that they provide. And they provide very good material, and everything is there. And there's no, this is bad and everything is excellent.
Yeah.
Everything is up to scratch. If something, you have a little complaint, they fix it. If something leaks, they fix it. If you don't have something, they give it to you. So everything is there for you. For once, go in as a doctor, don't go in as a student. And for once, they just want to see what you have to say or what you have to show. Just give it to them.
Yeah.
So if they want to listen to your case presentation, finally somebody actually wants to listen to you. They're interested.
Yep.
So deliver.
And you have your own your own style, which we were talking about it as well. You don't go and memorize somebody's script or somebody's style or somebody's words.
You say Pink said, I have no idea what it is.
Listen to this.
I have no idea what it is.
That's why they mix. They're mixing
and
up.
really, the room this is that cluster room. This is this. You go in, you read the scenario, you ask, you see what is there, you make your decision what you need to talk about to the patient, and you talk to the patient, and you can be in cluster 1, 2, and 3 at the same time. You
Yeah.
listen to the patient. They're not interested in listening to your lecture.
Yep.
They are interested to see, are you really have their best interest at heart? Are you actually really care at what they say? Do you actually really want to help them? Are you interested in helping them? Or you just interested in, just, I'm going to give you crown.
Exactly, and this is very, very important, and I want to clarify something very well. There is a difference between the three clusters. 100% there's difference. There's difference between the information gathering, the diagnosis management, and clinical treatment evaluation. But if you walk into that room and saying, when it's clinical treatment evaluation, I'm going to say this. When it's information gathering, I'm going to say this. You're almost guaranteeing a very high chance of you failing. But when you look into it, into the clinical eyes, which stage of the appointment am I at? If you've already done the examination, you will never greet the patient. So even if it is in information gathering, there have been cases in information gathering where you have done an examination or even
Or
a quick
even a
look.
photo.
Exactly, or even a photo. Know the stage of the appointment. It does not matter. Like some people go and say, because it's information gathering, 8 minutes is going to be dedicated for questions and one. Don't.
And this is when the examiner also can get annoyed. Imagine you just did. I would get annoyed. Like if I
Exactly.
was an examiner, I would not be as nice as they are. That's just me, because it is annoying when you just done my examination and then you come in and you say, "Oh, hello, my name is Dr. So and so. I'm going to be looking
And
after you." I'm like, you just did the examination.
Exactly.
Are you
Yes.
saying hello?
And it
Just
show-
Still
it's-
remember my days. Like it was 5 cases, and I was like, okay, every case is like I have done already this thing. So Mr. Peter, like it just started like
Yes.
okay, we have already done this.
You've
thing.
already done
Why
something.
to waste that another 2 minutes in introducing all the? You are in
It
the
shows.
middle of
It shows. By the
conversation.
way, if you're actually like a practicing dentist or not.
Yeah.
It's like
You just picked up where
Yes.
you left.
exactly, and that is one of the things what they look for. They look, are you showing the minimum competencies of a
Newly qualified.
newly qualified dentist? Like it's as simple as that. Now you've mentioned that as well, like you didn't have a problem with your time management. I know why, obviously.
I spend a lot of hours in the center. A lot of hours.
In the center and at home.
Yes.
And this is something very, very important, and I hope it lands on many people's ears. Even if you've done the exam before and you have passed your tasks, do not think that you're going to pass it again. You're going to have to practice all over again. You're not a beginner anymore, but you need to work on it. And I remember at the end, you were scoring really high points.
I remember you told me nobody's ever this good. There's always another level of mastery.
Yes.
Just keep improving.
Yes.
There's always better work. There's no such thing as perfect. There's always something that can be done better.
Yes. And this is where you're competing with yourself. You're not competing with anybody else. You've got the points, right? Like until you get 45 out of 45 every single time, I guarantee you there's another layer.
And even that doesn't guarantee anything, because again, your stress management, your inner environment, your outer environment, sometimes it's too hot, sometimes it's too cold, sometimes you ate something not well and you're not well, something happened, people go in, we all humans, we have our own lives, families, people have sickness, people have all sorts of things happening behind. It's up to you to actually control that and be present in the moment and do one thing at a time, and don't be in your head. Once you exit that room, leave it. It's done. Go in the new room, be present in the moment, be present with the patient, or perform your skilled or the task, and then when you exit the room, you leave it behind the door. You can't be in your head all the time, oh, I did this, oh, I've done that, and while
This
you're
is so
performing
important.
something else, you're thinking about the previous room, and then you also make mistake in the new room.
this is so important. This is actually applicable for part one as well. Just move on. Just move on. By the way, as soon as the exam, like the 2-day exam finishes, you can freak out as much as you want.
But in part one, I noticed that when I went back, because I finished with 1 hour in the first half, I had extra, and then I had extra hour. And what do you do when you have extra hour? You go back and you recheck your questions. And every question that I changed the answer, I changed it for the wrong answer.
Yep.
Every single
I hope
one
that you're
of them.
listening to this very well.
Every single one of them.
And you did the same. No, you were about to do the same for part two. Can you share this
I
really
actually
funny story?
I actually started to do the same for part two, yes. As you always say, know when to stop. Know when to stop. Because I finished pretty much, I had another hour and a little bit, and then I went to polish more and smoothen more and then do more things and look here and there.
This
And
is
what's
where the fatal
happening
mistake
when
starts
you-
happening.
When you're polishing your composite, you over contour it. You over contour it, you overdo it. And then what do? You add, because you know you need to fix it again, and then you polish it off back, and then I said, you know what, this game is never gonna.
Yep.
I have to leave now. So I asked the examiner, can I please, give all the tasks, and I left because I knew that I already ruined my composite.
Yep.
I over contoured it.
Yep.
It wasn't as nice as I always
Over carved
over
it.
polished, and it was not up to my standard, but I knew that if I break it, I might not possibly achieve that contact that I have.
Yes.
I might not possibly achieve something else. So I made a decision. Then I had your voice on the back of my mind, know when to stop. Don't go fixing your endo and making it a gaping crater where we can all sit and have a picnic. So don't touch it, make it functional, make it nice, produce the good work, and then I left.
Yeah.
And it was the best decision I've done.
Well done, well done. And this is we'll conclude it with this one. The decision making on the day of exam. This is what we work on a lot before the exam. So in the preparation,
That clock has a life on its own. You lift your
It's an alien
you lift your eyes on the clock, and 1 hour is gone.
It's literally it's like it's an alien world. Like the exam is in Mars, and then you're on Earth once you finish it. And what she has said, and this is something we really do focus on in the preparation, in the training, is not only know when to stop, but it's actually you probably hear me say that all the time as well. Like I always say, while you are practicing, like in the center and at home, good is not good enough.
Yes.
We're striving for excellence. It's a very competitive exam. I'm going to repeat it 1,000 times. It's a 15% up to 13% success rate. We just got to accept it. This is how the success rate is. But on the day of exam, good is good enough. On the day of exam, the only day, good is good enough. Because with stress, with the pressure of time, let me correct, let me polish, let me finish. Stop. Know when to stop, exactly like you said. Is it functional? And this is where you need to memorize your handbook as well.
Correct.
And by the end, you ate that handbook. you just. So she was practicing. She was attending the sessions. She was getting assessed. Despite the fact that you cleared your technicals the first time, you still, again, went, got assessed, was very consistent, followed the system, went back into the candidate mindset. You didn't say, oh, don't worry about it, I passed it last time, I'm just going to be focusing on like this case. The role play, you've been practicing role play nonstop. You had study partners, you were studying, you were reading. You truly deserve to pass.
Thank you.
You're very welcome. So I'm proud of you. Doctor, very well deserved, very well deserved. I really hope that her story has inspired you and that you got something out of it. She has shared a lot of things. It is very possible, guys. It's not a matter of if I'm going to pass. It's a matter of when I'm going to pass. Never give up. Never, ever give up. Every one of us have their own story until they manage to pass their ADC. There is a formula. The formula does work. Dr. Lily is one of many stories. I use you as well. Dr. Raj is another example, also passed her exam. She passed it from the first attempt with a very short period of time of preparation as well. But the common thing between them and the rest of who went and passed is they have put in the hours and they trusted the guidance. They trusted themselves that they are good enough for this exam, that they can be part of that 10-15% success rate. So they put in the hours. They never blamed. They never looked at what wasn't working for them. They only focused on what is in their control, and they trusted the guidance. They never got distracted. Dr. Raj, you said it as well. You know, people are coming to you. Exactly. Coming to her. Take these notes. Take, exactly. Just trust it. We know our formula.
That's the best part of Lily as well.
Exactly.
Yes, fully focused.
So, you know, in the end, whoever you choose, just it's that same success habit. Focus, trust yourself, put the hours, and just trust the process. You're gonna make it.
Yes, everybody makes it. Work on yourself. Don't expect the ADC to do, don't blame this examiner or that examiner. It is in your hands.
Exactly.
And whatever you produce, it wasn't they producing. They only look at it and assess your work against somebody else's work.
Yes, yes, and that's why we have to strive for excellence. Dr. Raj, any final words?
I think very well summarized by everyone here. And I'm actually very, very happy for Lily. And when I came to know about Bittrees as well, like it's amazing news. What I have seen with these people, yes, the conclusion point is by Dr. Lina, trust the guidance. You have an internal control, you don't have a control on external. But if your internal control is so strong, if you confide and if you trust your guidance, if you increase the positivity of your internal environment to that extent, external actually starts diverting to yourself. Like it turns into positive. And that's the life rule, I think, which we follow. Most of the success people follow, because if you yourself are not under your control, and if you are diverting, okay, this people said me this, or the exam is like that. And as Dr. Lily said as well, believe me, those who pass the exam, you will always hear, we always say that ADC examiners are really good, really
nice.
good. I actually love them. They are not there to kill you or fail you. There are genuine things, like whatever they are asking is basically gonna help you in real life. Like when we practice, we realize, yeah, that was the reason they asked us that question. And also with everything, like the material aspect, when people just keep babbling around, okay, this was not good, that was not good, actually me too felt like the material and everything was so good. And they give you, in fact, the lady used to come at the table and she used to ask, like, do you need this more? Like, I felt like, no, they are quite generous enough. It's just that how you have prepared your mindset. If you have a positive mindset, you are going to improvise yourself rather than blaming it on others. Yeah.
Thank you so much. And not only positive mindset, surround yourself with positive people. The negative people, shut them off. 99% of those who will finish their exam, they're going to blame everybody, the ADC, except themselves. It's always the 1% are those who say, I'm not going to blame anyone, including myself. There's no point of blaming yourself, because you're putting yourself into a very negative energy as well. It is what it is. It has happened. How can I move on? What can I do?
You win or you learn.
You win or you learn. Yep. That's a beautiful way to conclude it. Thank you so much, everyone, for watching. Best of luck for everyone who's preparing, whether for part 1 or part 2. Like I said, I hope her story will put a spark in you, that you will not give up and you will continue until you pass your exams. We will see you on another success interview very soon. Bye for now.